So the question we want to ask is, what is heart failure? What does it mean? And so you will hear a lot of different conversation about what heart failure actually is. And so we usually have a couple of different meanings when we say heart failure. Well, the main one is that the heart pump is not working as well as it should. And I like to liken that to when you have any of you who are automobile enthusiasts, if you have an 8-cylinder, a V8 car that it has all cylinders working, when you step on the gas to go up the hill, it just flies up the hill. If you are going, if your car has only 4 cylinders working, you've got bad cylinders, when you go up that hill, you struggle to make it. It's the same thing that happens with the body. When the heart is not pumping well, takes a little bit more effort to get anything done, and people fatigue very easily, as the previous slide was saying. So a heart failure then is something that we realize is a problem, and what we like to do is, as soon as we know there's an issue, we like to have that taken care of. Now, as we go through our conversations, we will talk about, of course, early treatment, but also what happens as we move along in our course of treatment. Next slide. And what I thought we would do, you can, next slide, you can play that one, is to give you some visuals about what heart failure looks like. So in this first group, you can see 2 hearts. One is a normal heart, and one is a heart with heart failure. The one to the left of our screen, if you look at the heart, it has 4 chambers. On the blue side, there's an upper chamber. There's a valve that separates that chamber from the lower chamber. That's the right side of the heart. The right side of the heart is the side of the heart where blood that has been used is emptied into. It goes through the lung and then is pumped back from the lung into the left side, which is where we see the red portion on the cartoon. It also has 2 chambers, a small upper chamber and a lower chamber. And when you look at the normal heart, you see that all the chambers are really just about the same size. If you look to the left, to the right, where it says heart failure, you see that the chambers, if you compare those to the ones on the left, are larger than the ones on the left. That means that the heart is enlarged. It's not, the muscle is weakened and is not pumping blood as effectively as it should. Because it is a big, what we call a baggy heart, it doesn't have as much oomph to get the blood out of the heart. Now, where it says next by the arrow, I want you to play that. Just click on that. So this is an example of what a normal heart looks like. And you can see here on the blue side, you see blood coming from the upper, which is the brain, and going into the what's called the right atrium. It goes through a valve and then it goes into the right ventricle. That's the blood that has been used. The oxygen has been depleted to some point, and then that blood then goes through into what we call the pulmonary artery. The pulmonary artery then sends the blood into the lung, it's freshened up, and comes back to the left side of the heart through the what's called the left atrium, and then through the mitral valve into the left ventricle. So that is what a normal heart function should look like. And next slide. And so this again is that big baggy heart that we looked at first, and we see here that the same thing is happening, but the left side of the heart, in particular in this instance, is larger and it doesn't work as effectively. Now, the interesting thing is this can happen to the left side of the heart as well as the right side. But when the heart muscle is weakened like this, that's what we call heart failure. And next slide, we can exit from this one. So then the question that all of us, I'm sure, are sitting on the edge of our seats asking is, what is it that causes heart failure? And so there are a host of causes, and I want to just mention a few of them here. These are probably the, the main ones that cause heart failure. Anyone who has coronary artery disease or who has had a past myocardial heart attack, both of those impair the blood supply to the heart muscle. And so as a result, the heart muscle does not have the oxygen that it needs to function, and that can cause the heart to weaken. Those are very common, and a number of people have coronary artery disease, even if they don't have a heart attack. But certainly a heart attack can damage the heart immediately. One of the more common causes of heart failure is high blood pressure. And we'll speak a little bit more about this because this is actually a very important cause of heart failure. And if you treat which is why it's important to treat your heart failure or your high blood pressure early and get that blood pressure down so it doesn't put a lot of strain on the heart. So again, if you think about high blood pressure, how does that work? If you think about lifting weights, for example, if you're a bodybuilder and you're starting to lift, you start with just a lighter weight. And so as you lift a weight, the muscle gets bigger. As you lift heavier weights, the muscle gets even bigger. Now the heart does that to a point, but there's a certain point at which the heart muscle, when it gets bigger or thicker, it actually begins to work less efficiently or less effectively. And so high blood pressure is like weightlifting for the heart. Another problem that can damage the heart are abnormal heart valves. And this can happen over time as we get older. Sometimes the valves deteriorate. Sometimes you can get an infection in the heart that can damage the valves. Some people are born with abnormal heart valves as well. Another type of heart disease which can cause heart failure is what we call dilated cardiomyopathy. And I think this is really important, particularly in these days, is because a dilated cardiomyopathy means it's just a weak heart muscle. There really was no problem with the valves or the blood vessels, but the heart muscle itself is damaged from some cause. Today, for example, we talk about the COVID pandemic that's going on. We have had patients who have had heart muscle damage because of inflammation related to the virus that can cause the heart to dilate. But the hypertrophic heart is a thick heart, which sometimes can cause the heart muscle to thicken or stiffen. And it can be, if it's like I said, if it's too thick or too stiff, it does not work as well. And then finally, on this slide, persons that can be born with congenital heart defects that can cause heart damage and can cause a heart failure as well. Next slide. So if we look at coronary artery disease, for example, this is an example of two different problems. One, we look to the far right of the slide. We see there is a yellow plaque buildup where there is cholesterol buildup, which is actually restricting blood flow to the heart. That can reduce the blood flow to the heart, which again can impair the heart muscle, making it weaker. In a number of instances, if that cholesterol builds up to the point where it blocks flow completely, that can result in a heart attack, which causes immediate heart damage and can cause weakness of the heart. And if any one of you are old enough, I don't see anybody in the audience that might be, remember Stanford and Son. He used to say, Emma, this is the big one. What he was talking about was a heart blood vessel blockage that was sudden onset that blocked the main heart vessel that supplies blood to 40% of the heart. And that can stop your show immediately. So buildup of plaque can cause heart blockages and can cause heart damage as well. Next. The cardiomyopathy we talked about, this is a visual of what it would look like. On the left side of the screen, we can see that this represents a heart muscle, and the yellow portion is actually the muscle, and the main chamber here is the left ventricle. You can see what the size or the thickness of that is compared to the one on the right, where it is significantly thicker or has more volume than the heart on the left. The one on the right is what we would call a hypertrophic cardiomyopathy, which is related to a thick heart. Next. Heart valves, again, are one other kind of problem that we mentioned earlier that can create a problem as well. If you look at the heart, and there are 4 valves in the heart, 2 on the left side called the mitral valve and the aortic valve, and 2 on the right side, one called the pulmonic valve and one called the tricuspid valve. When these valves, what they're meant to do is to allow blood to go in one direction. And when the blood goes in one direction, the valve typically closes behind it. And when the heart squeezes, it pushes blood again in a single direction. When the heart valve is leaky, the valve that is supposed to close behind does not. And in this example, you can see there's what's called an aortic valve, and there's what's called aortic regurgitation. But you can have regurgitation or regurgitant flow in any of those 4 valves that we mentioned. So again, when the heart is pumping blood, it pushes blood through that aortic valve into the aorta, which is where the fresh blood goes that gives you blood supply to your brain and to the rest of your body. In this example, instead of the blood going in one direction, which should be from the left ventricle or the LV to the AO or the aorta, it's going from the aorta backwards into the left ventricle. And so now what you have is you have blood going backwards, but you still have blood coming from the other direction. So now you've got a problem where the heart is really filling up, and this can cause the heart to really dilate and enlarge and weaken as well. So any heart valve that is not working well can cause this kind of problem. And again, when we look at a valve here, for example, when you open this spigot, the water goes in one direction. When you close it, it stops the backward flow of water. Can you imagine what would happen if that valve was bad and the water was flowing backwards into wherever it was coming from? This is what happens, can happen in the heart, which is another type or cause for heart failure. Next slide. Now, this, I think, again, is one of the major causes, because as you think about high blood pressure, we often call it the silent killer, because it's doing its damage silently when you don't feel anything, there's no problem, and then all of a sudden it feels as if, when did that happen? But it's been building all along, which is why we ask people who have high blood pressure to monitor the blood pressure, take the medication as scheduled, and make sure that blood pressure is in a normal range. So a normal range, for example, is a blood pressure, the systolic or the top number should be 120 to 140, and the bottom number should be about 70 to maybe 89 as a low part of the blood pressure. And when it goes outside of that range, it's starting to cause damage to the heart. Now, it doesn't just damage the heart, it damages other parts of the body. It damages the liver, it damages the kidneys, a major cause of dialysis, patients needing dialysis. It stresses the lung and causes it to produce some substances which strain the body. It also damages the heart. So high blood pressure is really a major cause of congestive heart failure, or CHF. Next slide. There are many other causes. Well, people who have lung disease can have heart problems as well. People who have diabetes also can damage the heart, typically because diabetes damages the blood vessels that supply blood flow to the heart, and not controlling the diabetes really is a problem. And what we say about diabetics is that if you have diabetes, it actually is equivalent to someone who has had a heart attack, even if the diabetic has never had a heart attack. So let me say that again. Having diabetes, even if you've never had any problem with your heart, gives you the same risk of having heart disease as someone who has had heart disease or had a heart attack who has not had diabetes. So diabetes is what we call a coronary equivalent. So having diabetes, we feel, is about the same as having heart disease. Obesity is another issue. And one of the reasons for this is that not only the additional strain, but in a number of instances, it is because of the problems that occur with obesity. For example, a lot of patients will have high lipids. Obesity can be a precursor for developing diabetes as well. And typically, not all patients who are overweight but obese, typically it may mean that your activity or your lifestyle is such that you're not very active. And we will mention later that it's important for all of us to make sure that we are getting at least 30 minutes of exercise on a daily basis, whatever form that suits us, to keep us active and to keep our calories down. But it also helps with controlling diabetes and blood pressure. Sleep apnea is a problem that we're seeing that happens in a number of diabetics, not all, but a number of diabetics. And the problem with sleep apnea is that it can cause a strain on the heart because when you stop breathing, you don't get the oxygen flowing through the body like you should. So you have a body that's working on less than it should be. It's in what we call an acid milieu or acid environment. And that causes damage to the heart and can cause heart irregularities. And so sleep apnea is another issue that if you have that problem, it's important to take care of that. It can cause arrhythmias in addition to heart problems. Next slide. So when we think about heart failure, I think this may be where the rubber meets the road. So if we think about it, 1 in 5 Americans will develop heart failure. Now just think about that. If you look at our screen tonight, there are probably, I don't know, 25 or so persons on there. And that means at least 5 of us will develop heart failure at some point as an American. If you're over 40, again, 20% of Americans will develop heart failure during their lifetime. And because of all of those reasons that we talked about, diabetes, high blood pressure, obesity, sometimes congenital disease, and valve problems or infections that you don't necessarily have anything that you can prevent. And so it's important because it affects so many of our fellow citizens. 6 million Americans currently are living with heart failure. Now, this number was published in about 2014. And so over the next 15 years is expected to rise by about 15%. So we're talking about in 2030, and we're not that far from there. So it's not 15 years from today, it's 15 years from 2014. And again, a point, high blood pressure increases the risk of developing heart failure. And again, 1 out of 3 Americans have high blood pressure, and 1 out of 5 Americans develop heart failure. And principally, high blood pressure is a cause of that. Next slide. And so this is the same information, but again, just looking at it in kind of a cartoon figure. 2012 on the bottom left, 2030 on the bottom right. And we see a small person here representing the number of people. And over that period of time, 15 years or so, the number of people in 2030 will have increased by at least 46% of the number of people having heart failure and living with heart failure. Next slide. Now, it's not just a cost to the person, but if you think about it, you know, we have issues with healthcare and funding the healthcare system. And so when we look at the cost of healthcare, a large portion of the healthcare dollars are spent on managing congestive heart failure. And at about the time this conversation started, with, like we said, around 2014 or so, the US was spending about $30 billion a year to treat heart failure. And again, with that 46% increase in the burden of patients or people having heart failure, that is projected to more than double by the year of 2030, which is coming up in just a few short years. And again, as we get older, the risk of heart failure goes up, as well as the risk of having high blood pressure. Most of the dollars is spent in the hospital due to heart failure. And when we look at, for example, the number of patients that are discharged from the hospital and the diagnosis that they discharge with, predominantly it is congestive heart failure. And so one of the reasons that we're having this conversation tonight is to say, what can I do to prevent myself from winding up in that situation? Or if I'm in that situation, how can I prevent it from getting worse? Now, when we say heart failure, we say, well, that's for someone else. But I think that if you do have heart failure, there is a cost to the person, and not just to the person, but to the family as well. And so our bottom point here is that for patients who have heart failure, a lot of times they will lose time from work, which means they lose income. They're not able to participate in household activities or family activities. They're not able to help around the house. So that puts more burden on the caregiver as well as the other family members. And then, of course, the outcome that we don't want to talk about or we don't like to see is that in a number of instances, family members are lost. So now when we think about this last point, from the time that someone develops heart failure, within 5 years, in the elderly population over about 65, within 5 years, half of the people who develop heart failure are no longer with us. So this is a significant and an important disease that we need to be conscious about. Next slide. And this is just another cartoon to say the indirect costs, loss of work, not being able to do things around the house, and loss of life. And again, looking at the cost, not just for the person, but for the entire country, because all of us make a contribution to the care of each other. And this is a very high cost disease that we can do something about to help ourselves. Next slide. Next slide. All right, so how do we diagnose heart failure? You can roll the tape. How do we diagnose heart failure? There are a number of tests that we do, and this is going to be, you can play. This is one of the tests that will help us talk about ejection fraction. We'll come back to it.
For a heart that is not able to pump enough blood out to the body. When a heart problem like heart failure is suspected, your healthcare provider may wish to order a test of your heart's ejection fraction, or its ability to contract well and pump blood out to your body. The ejection fraction compares the amount of blood in the chamber to the amount of blood pumped out. The percentage pumped out is your heart's ejection fraction. When your heart's ejection fraction is normal, about 50 to 70% of the blood is pumped out of the chamber during each contraction. With a normal ejection fraction, your body has the blood supply it needs to perform your regular activities. A borderline ejection fraction means that your heart is pumping out a little less than half of the volume of blood in the chamber. With the borderline ejection fraction, symptoms like shortness of breath may become noticeable during regular activities because oxygen-rich blood is not getting adequately pumped out to your body. A reduced ejection fraction is when roughly 40% or less of the blood is pumped out of your heart. With a reduced ejection fraction, symptoms become noticeable and may even happen during rest. Performing normal activities becomes harder to do. The good news is that many people are able to improve their ejection fraction and reduce symptoms with proper care and treatment. Talk to your healthcare provider about your options. And if you've been diagnosed with heart failure, Tracking your symptoms can be an important part of living a longer and healthier life.
Okay, you can pause there. So I want you to take note of, and I'll bring it up again at the end of the conversation, some of the websites, because you can go to the next slide. You can go to some of those websites and get some of this information for yourself, because I know it may be a little bit dense and a little bit for us to remember if this is not something that we do on a regular basis. So the symptoms that we just talked about, again, are very common. Patients get short of breath when they have congestive heart failure. And the reason for that is more than one-fold, actually. Sometimes it's because they've got congestion in the lungs, but in a number of instances is because persons are debilitated, and when they do any activity, because of deconditioning, they get fatigued and short of breath very easily. Some people get coughing and wheezing, and you can see some people, particularly when they're lying down, the fluid from the lower part of the body backs up into the lung, and that can then irritate the lung and cause the body to try to expel that, and it does that by coughing. The wheezing happens when the blood vessel, when the airway in the lung gets congested and develops a phlegm or mucus in the lung, and as air passes through that mucus, you hear a wheezing or whistling sound. The excess fluid that we talked about, in a number of instances, patients will have swelling in the feet or legs, but some people do not have any swelling in the legs or feet and still have heart failure. Some people will just feel a congestion in the belly or swelling in the belly, and sometimes will lose their appetite as a result of that increased congestion in the belly. And again, there's not enough room for the stomach, for example, to ingest the normal quantity of foods. Fatigue, of course, and appetite we talked about, as well as sometimes because you're not getting proper sleep, because you have lung congestion and not proper blood flow to the brain, you can have some impaired thinking. An increased heart rate can happen because, again, you're deconditioned, because the heart is struggling or straining to do what it normally will do. And so sometimes it will beat faster to try to circulate a smaller amount of blood. Because the ejection fraction is not strong enough to give the body as much blood as it needs to, the heart has to beat faster to move blood through the body. And so ejection fraction is the number that we use to determine whether the heart function is normal or abnormal. And that number, again, is between 50 and 70%. Now, having said that, there are other types of heart failure where the ejection fraction can actually be higher than 50, can be in the normal range, and persons can still have congestive heart failure. One of which is related specifically to high blood pressure, because it stiffens the heart and does not allow the heart to expand, and can cause a limited amount of blood being pumped through the body, and can cause signs of heart failure as well. Next slide. And I want to play this video for you, and we will come back to this on the other side as well. Again, the signs.
Do you know the symptoms of heart failure? During heart failure, the heart can't pump blood efficiently enough to meet the body's needs, because either its pumping ability has weakened, or because the lower left chamber has become thick and no longer holds enough blood. Without proper pumping, fluid can build up and cause symptoms that everyone should learn to recognize. Swelling, also known as edema, is most often noticed in the feet, ankles, legs, or abdomen. Sudden weight gain. People with heart failure can also track their weight to help manage any swelling. Shortness of breath is another important symptom to discuss with your doctor, especially if you notice that normal activities are getting harder to do, or that your breathing is often interrupted by persistent coughing or wheezing. You should also speak with a healthcare provider if you lose the ability to sleep and breathe well while lying down. Inadequate blood flow can also cause lightheadedness or fatigue, confusion, depression, or even fainting. Additional symptoms can sometimes include a rapid heart rate, nausea, or lack of appetite. If you notice these important symptoms, be sure to seek medical care. Know the symptoms so that together, people who have heart failure can track symptoms to help manage it successfully for a longer, healthier life.
Okay, you can pause there. Okay. Very good. And so our next slide, we get to the point where we start talking about what we can do or what can be done about congestive heart failure. And so one of the things is, of course, how we take care of our bodies is going to determine how our bodies take care of us to a large portion. For patients who have heart failure, there are a number of different types of medications that are used to treat the symptoms and sometimes to reverse the effects of heart failure. And finally, the surgical procedures and devices that sometimes are used when patients have advanced heart failure. Next slide. So our lifestyle changes, and there are a laundry list. And I think most people are pretty familiar with the things that are here. We mentioned that patients who have a weakened heart, we tell them to avoid or limit alcohol. Alcohol, actually, as we used to say in our training program, is a 2-carbon fragment that poisons the heart. So the more severe your heart failure, the more we tell our patients not to imbibe alcohol. So alcohol itself is a toxin and can cause heart damage. Limiting caffeine is a problem for some people that have fast heartbeats. Caffeine further stimulates that heartbeat to increase. And again, because a fast heartbeat does not allow the heart to rest and recover, it's important to have actually a slower heartbeat, which is why we use some of the medications that we do. Eating a heart-healthy diet, making sure that we have plenty of fruits and vegetables, grains and nuts, limiting our fat intake, limiting our salt intake in particular, and depending on how your heart failure is, sometimes limiting the amount of fluid that you intake as well. Being physically active actually helps to recondition the body so that some people who are fatigued, once they go through rehabilitation or exercise program, actually feels better. Stress is one, tracking symptoms, monitoring blood pressure we talked about, getting your proper rest, that's when the body heals itself. If there's some questions and some people are feeling depressed, sometimes there's some support system that can be helpful. And one thing that is important, we talk about getting vaccines for the flu and the pneumonia in our heart failure patients, because as we mentioned earlier, if they have an infection, that can actually inflame the heart and further worsen the heart failure. Following heart patient guidelines for sexual activity, that's a conversation that you should have with your physician if there is a question specifically about that, because each person is at a different stage or maybe at a different stage of their heart failure. And of course, selecting clothes that are not too restrictive are helpful as well. Next slide. And so we talked about increasing activity. We recommend, even for our heart failure patients, as long as they are not in what we call a decompensated state, which means when you're sick and short of breath, we do not recommend exercise at that point. But patients who are stable, we do recommend that they become more active and provide cardiac rehabilitation for them. Cardiac rehab is a structured program where, as you look at these bullet points, patients can get information on a regular basis. Usually a cardiac rehab program is 3 times a week for 12 weeks. And during that period of time, you're meeting with counselors that can talk with you about diet, about exercise, about salt, about fluids. And it's a lot more, I guess, contact than it would be with seeing your physician every month or every 2 months or every 3 months or every 6 months. And so this is really helpful. In addition, it provides a support system where there are other people who are having the same or similar problems that you can get to converse with. Next slide. So in terms of medications, I'm not going to belabor this because there are a host of medications, and the medications that you use will depend on what your particular problem is. Some of the mainstays for heart failure treatment are the ACE inhibitors or the ARBs. An ACE inhibitor is something like lisinopril or Acupril, or and the angiotensin receptor blockers are things such as Diovan or losartan are some of the common ones. One that is really popular these days is called the Artis, which is, if you've heard and I'm sure there's no way you could not have seen this because the airways are filled with advertisements for Entresto. And Entresto is an ARNI that actually helps to reshape, remodel, and improve heart function. Beta blockers we use to slow the heart rate down to allow the heart to heal. And of course, one of the other mainstays is diuretic, which is used to eliminate the extra water. Specialty medication is one that's called hydralazine and isobid, or Bidil is another name, and is specifically used in the treatment of African Americans. And aldosterone is used at certain stages of heart failure. Spironolactone is an example of that. Next slide. There are certain devices that when patients become a little bit more ill, we recommend for them. Some of the devices, for example, in implantable cardio defibrillator is what we call a shock box. So if your heart were to stop, and unfortunately, as patients' hearts enlarge and weaken, there's an increased risk of what we call sudden heart death. Implantable defibrillator can actually reverse or stop, can shock the heart and bring a person back to life. Some people who we use cardiac resynchronization therapy. There's a special type of heart failure and EKG pattern that we recommend this type of device. And it in fact can actually help the heart heal and improve as well. As people get sicker, sometimes they get put in what we call a left ventricular assist device, which is kind of a artificial heart that you can walk around with. And of course, there are surgical procedures that are used for treating the heart, including heart transplant. If you've got blood vessel blockages or valve heart problems, there are other things that can be used to help with that. Next slide. So for example, we were talking about the ICD or implantable cardiac defibrillator or the biventricular pacemaker. It's actually a pacemaker device that's put in underneath the skin and put in into the heart and into actually the left ventricle and into another area called the coronary sinus to treat certain types of heart failure. So this is what a pacemaker device of several varieties would look like and how it's inserted into the body. Next slide. Open heart surgery, of course. We talked about the left ventricular assist device. It has to be implanted surgically. Surgical treatments for heart failure. Some people actually have to have aneurysms and have part of the heart removed so that the flappy part of the heart is not there and the working part of the heart is available. And then heart transplantation, of course, is when the heart is so far along that it has to be removed, and another heart is a donor's heart is given to that person to help it function. And of course, in valve replacements, so if you've got a leaky valve, if you've got a valve that doesn't open, then valve replacement can be used to help treat patients with heart failure. Next slide. Coronary angioplasty is a procedure that we perform on a regular basis. And so patients who have a blockage, as you see in the top of the slide, a balloon with a stent is placed into the blocked area. The balloon is inflated and the stent is left behind. The balloon is then deflated, taken out, and the stent is left behind. and that restores blood flow to an area that was not getting the blood flow to that portion of the heart. Next slide. And I think that is going to bring us to the end of this conversation. And I don't know if there's any way to ask questions, but this is what I wanted to leave you with. This is from the American Heart Association, and heart.org/congestive heart failure will give you a lot of information about what we've just talked about, including some of the slides that you just saw, the symptom trackers, and can probably answer some of the questions that you have.